I'm Dr. Doug Bartels, an orthopedic surgeon and sports medicine physician with Mayo Clinic Health System, and I'm here to address some questions you have about ACL injuries. Yeah, so you've got a number of ligament structures around the knee that help provide stability to the knee, that allow you to do things like cut and pivot and move when you're participating in sport or even just day-to-day activities. So, ACL, the anterior cruciate ligament, is one of those ligaments that helps provide stability to the knee joint itself. It's one of the more commonly injured ligaments in athletes of from our weekend warriors to high-level athletes. It's one of the more common ones, and so oftentimes when people tear their ACL, they'll have a sensation of instability, especially when they're going through higher level sport or anything that requires cutting and pivoting. A lot of people won't even notice that they have a torn ACL if they're just walking around on a day-to-day basis, but as soon as they start to try and do a higher level activity that requires them to jump or move or pivot, they really notice that sensation of instability or the fact that the knee could just give out on them. Early on, there'll be a good amount of pain. So usually what people will talk about when they injure their ACL, it's either just a non-contact injury where someone has cut or pivoted, or sometimes it can involve a kind of contact injury to the leg. But the kind of most common thing that people will say is that they feel a pop, they have the immediate onset of pain, and they have some swelling. A lot of the time, people are able to get up and walk, but they do have some pain and swelling, but they are able to get up and keep walking. Most of the time when the ACL is torn, it's not one of the ligaments that has a great capacity to heal itself, from everything that we've looked at. So, our usual recommendation, especially in people that are going to be involved in cutting and pivoting activities, is to move forward with a reconstruction of that, because the ACL just doesn't have a great capacity to heal itself most of the time. We've identified kind of certain muscular imbalances and weaknesses, with hamstrings, quadriceps muscle, hip, core. So just maintaining a good kind of balanced workout regimen to strengthen all of those, the non-show muscles. So your biceps, your triceps, all of those things that everyone likes to show off at the beach. Injury prevention is oftentimes about strengthening those muscles that are less showy. We've got our physical therapists who can do those evaluations. If you're really, interested in injury prevention, they can take a good comprehensive look and see which areas you might be a little bit weaker in that they can target, and they can give you exercises that you can do kind of in the home setting to really help prevent against injury. A lot of it is, about the work that you put in before you get out on the field or the court or the rink or any of those places that we compete. To learn more, please click on one of the links on the screen or in the description below.